Wellness Wednesday is brought to you by Brite White Dental.
Today we're at Brite White Dental and we're going to be discussing early orthodontic intervention. And we're here with Dr. White and we're going to talk about, we hear about orthodontics in your teen years, but actually early intervention is something you can do. Tell us about that and some of the benefits of that.
So a lot of people don't realize that 53% of the jaw size and 80% of your skull size is done by age 2.
Wow.
2. So, and 80% of the jaw size is completed by age 6. So why are we waiting until their jaw size is essentially fully grown before we're doing anything about it? So we want to capitalize on those growing years and encourage that growth, that forward and down growth, to make sure that our jaws and our children are wide enough to accommodate their 32 teeth. And yes, I said 32 teeth. I don't want to see any of our children have to have their wisdom teeth out. I want their jaws big enough to accept all of those teeth, line them up straight, because if we can do that, that means their tongue is going to have enough space to live inside their mouth, and they are less likely to have any kind of sleep disorder breathing and less health issues as they grow up.
Tell us about the HealthyStart program and how does that differ from just everyday braces?
So HealthyStart is different than your traditional braces because it's a removable appliance. It's an appliance that the kids wear at night and for a few hours in the evening. So it's nice that you don't have to worry about avoiding certain foods or having to worry about wires and stuff poking you. It's kind of nice to go that, and it helps guide the teeth in naturally. We want to help these teeth come in, it pretty much come in straight. We are not going to try to jerk them around once they're already in.
What are some signs and symptoms that parents should watch out for to know that they need to come and get early intervention?
So if you see that your toddler even has you might look at your toddler and say, hey, they've got perfectly straight teeth and there's no spaces. That is absolutely the problem. You want to have at least a nickel in between every one of their front teeth. Otherwise, they probably don't have enough room for their adult teeth. So we can start them earlier and make sure that those teeth come in straight. And it's not always about their teeth coming in straight. We want them to be healthier. If your kid have a lot of ear infections, if they have a lot of throat infections, if you hear them snoring at night or stopping breathing, God forbid that, you want to make sure that we can also help them with those things. Bedwetting is something that people don't really associate with these sleep disordered breathing and the not having enough space in their mouth. And we do not just only HealthyStart, we also use fixed expansion. Sometimes kids need a lot of expansion all at once. And so we want to make sure that we, again, capitalize on that growth and get as much growth out of that jaw that we can. And we are seeing these kids have a reduction in symptoms. It's truly amazing to hear a parent come in and say, my 10-year-old went from wetting the bed every single night to not at all inside of a month. There's no other explanation than the expansion that we've been able to do for them. Another thing, the earlier you intervene, usually the cheaper it is, honestly, too. And you can also help your kids. If they're sleeping better, let's get them while their brains are developing and make sure that they're sleeping well so that they can do better in school. A lot of kids with sleep disordered breathing, those symptoms look a lot like ADD and ADHD. And they actually did a study where they put kids with sleep disordered breathing and kids with ADD and ADHD in a room together, and the doctors couldn't tell which kids were which kids. And that's because so many of the symptoms line up. I feel like we really need to be checking these kids' sleep and diet before we're rushing to put them on ADD or ADHD meds, because a lot of times some airway and some nutrition and some nasal breathing is really what they need.
So where can people find more information if they want to come and get a consultation?
If you want to come in for a consultation, we are accepting new patients, and it's easiest just to give us a call.
So what concerns did you have about your child before doing HealthyStart?
Before we started HealthyStart and came here to Brite White Dental, my son had multiple rounds of ear infections. I think we had 3 sets of ear tubes. He had his tonsils, his adenoids removed. but he kept getting ear infections and he was snoring. I ended up having a sleep study, found out he had mild obstructive sleep apnea, was stopping breathing like 70 times a night. But he was, well, if he's 8 now, he was probably like 6 or something at the time and had already had all that. And I just wanted to find some way to help him sleep better. And I had previously worked with Dr. White and I knew that she did airway things, but I wasn't sure if she did it for kids or not. So I just reached out to her because I was kind of at a standstill. I didn't know what to do for him. And she said, yeah, bring him on in. So we came in and she was able to help him.
My main concern was he wasn't sleeping. Like, he was chronically exhausted. You could tell he had bags in his eyes. He would sleep a long time, but then he'd wake up and he'd be so groggy, and it would like affect his attitude and his just like mental stability. Like, he was really frustrated a lot. You could just tell he wasn't sleeping.
What has your experience been like at Brite White Dental?
I'm really kind of surprised at what seems like so little has helped so much. He has this gizmo appliance that he would wear at night to help realign his mouth while he's sleeping, help keep his mouth closed. But even just that, he didn't snore as much. Then he graduated from that appliance to a different one that he wears at night. He calls his gizmo. He doesn't snore like hardly as much. I haven't had another sleep study scheduled to see how that's progressed, but it definitely has. And then she also did a CT scan here with him, which the before and after pictures of that are crazy too. She's got the picture of him and his airway not wearing the appliance, but then the picture of it wearing the appliance, you can see that airway just opened up. And so when he's wearing that at night, that's how he's sleeping. He's sleeping so much better, more rested. Before and after pictures of that too, the bags under his eyes are like gone. It's awesome.
He sleeps now with his mouth shut, which is huge. He wakes up like rejuvenated in the morning and ready to go instead of just like moping around. He has a really good attitude. His mouth looks way better. We were really concerned about his canine teeth. They were like stuck up there. They've come down and he has a really nice smile now.
Awesome. For parents out there who may be concerned about starting orthodontic care early, what would you say to them?
I would say do it. If you can, we make an hour drive here. We made it work and it's well worth it. It's really changed his life.
I would say early ortho care, even if you think they're too young, they're probably not. I think a lot of people probably wait until like more of their adult teeth come in. That's also part of the reason why I brought Evan here. I'm a dental hygienist myself, and we'd been to an orthodontist, but they like didn't want to start treatment. But I knew from my dental experience, he did not have enough room in his mouth. So kids, the younger they are, their bones, they're more able to move. Like, younger is always better. And if you're unsure, just come get a consult.